If you're a urologist trained within the last 20 years, you probably were trained during your residency program to read your own x-ray films, including CT scans and MRIs. Well, the problem with these advanced imaging modalities is that when patients bring in the past, film, it was a lot of images and you have to put them up in the viewers. I have found better ways to more efficiently look through images digitally. Nowadays, you have the ability to access imaging center portals. When you order an imaging study, advanced imaging study from an imaging center, you can access their portal in a secure fashion to look at those images. However, if you are the physician taking your time to log in, to find the image, and also to then download it, it is not as quick as the way I used to do it. So let me tell you how I used to look at advanced imaging very quickly. I used to have the patients bring in their compact discs of their actual images into my practice. At the front desk, one of my staff will load the CD, the entire CD, onto a computer, my workstation, onto the computer's hard drive. All I have to do is double click on a study and it'll pop right up using the native viewer that is built in onto the CD. Now, the downside is that certain imaging centers have viewers included on their CDs, which suck. They are slow, and it's difficult to find all the different cursors and ROI cursors and measurement cursors, and looking at dual pane monitors. Like using a viewer software, I can display the images like what you see on a radiologist's workstation. On my workstation, I have two monitors in portrait orientation, which allows me to display CT images in sagittal, in coronal views on two different images, two different screens, and I can scroll through them very quickly. So that's how I used to do things. It would require the patient to bring in the CDs. My staff would have to load the images to a local workstation folder, and then I would then double click on it. It would load the fastest, allowing me to look at the images with the best fidelity without any loss of detail, and also allows me to manipulate the images. For instance, for a kidney stone, I can put a cursor over it and measure the ROI, region of interest, attenuation. And from the Hounsfield units, I can then determine this is a calcium stone or it may be a softer stone, and then dictate my treatment depending on the measurements. So that's how I used to do things. I thought that was the fastest, the most efficient way for me to look at images without losing any quality. Now, until recently, this is by far the fastest and most efficient way. I have purchased and I have been running an imaging software, DICOM imaging viewer called eFilm. I've been using that for years because I hated some of the viewers from certain imaging centers. They were slow and they're difficult to maneuver, so I bought my own viewer software. I would then import some of these CDs into the viewer. That's what I used to do in the past when I didn't like the viewer that came with the disc. So now imagine if you order imaging from an imaging center, those studies that you ordered are automatically downloaded to your workstation where you are running the viewing software that you are familiar with using, that you purchase, that you know how to manipulate, that it loads the fastest that's possible. Imagine on your work list using that software, it automatically has all the studies that you ordered from an imaging center directly downloaded onto the workstation. So all you do every morning is that you fire up the software that you use to look at images, your preferred software, and all the imaging studies that you ordered from an imaging center is already downloaded. Perfect fidelity, the best quality, the fastest. There's no faster way. There's no downloading by anybody manually. This is by far the fastest way to view images that you ordered. Now, how do you get this done? Your imaging center from which you order the images has to have the ability to automatically send in a secure fashion the images that you ordered and then download it onto the workstation. So they have to have the ability to do that. Now, if this is any reputable imaging center, they probably have radiologists remotely looking at their images and giving reads. This is the same type of interface software that they provide for the remotely viewing radiologists. And you're doing nothing different. And this is, they can do this in their sleep if this is any reputable imaging center. So by far, this is the fastest, the best way, and the most efficient way to look at advanced imaging in your practices. I encourage you to look into it. It is just absolutely amazing. So check it out. Ask your imaging centers to maybe provide that interface. You, of course, need to have the capital outlay of this imaging software. I personally use eFilm. It loads very quickly. It can do 3D reconstruction if you want multiplanar reconstruction. It is just another piece of software, but it's a very, very powerful and industry standard viewing software. Check it out and let me know what you think. If you like this video, hit the like button, subscribe, turn on the notification bell, or simply give me a thumbs up if you're watching this on Facebook. Take care. Bye-bye.